Good evening, everyone, and thanks so much, Adelanti, for that introduction. So my name is Kelsey Kritma, and I'm the Executive Director for Philanthropy Advisors in Geneva. We're a consulting firm in the philanthropic space. And I'm also a member of the Giving Women Network, and I have been for over a year now. And I am absolutely thrilled to be here tonight to moderate this panel of phenomenal women from around the globe to talk about a topic that is incredibly important for every human, regardless of your gender, your nationality, your economic status, whatnot, maternal health. So I've been working in global health for the last 15 years, most of this time in East and the Horn of Africa, but also West Africa, Asia, and pretty much around the globe. And I have seen firsthand the vast differences in access and quality in maternal health care across everywhere from Kenya to South Sudan, Somalia, Sri Lanka, Vietnam, Ghana, and many other contexts, often in low and middle income countries. And this is where I would like to set the stage tonight as we lead up to our panelists and our discussion and our Q&A. A few statistics to share, shocking statistics actually. The WHO, when they release these stats every year, sometimes we see increases and we see successes, but ultimately they're still quite dire. So at the moment, approximately 810 women die every day from preventable causes related to pregnancy and childbirth. And more than 90% of these deaths are in low and middle income countries. So despite gains made around the Sustainable Development Goals, and specifically SDG 3.1 to reduce maternal mortality, we still have a long way to go. And ultimately, why are we here tonight? We've seen interests peak and fall depending on donor priorities over the years, depending on different factors across the globe. But the COVID-19 pandemic is absolutely no exception. And whether maternal health is continuing to get the importance, the funding, the attention, the awareness that it deserves, and ultimately that it needs, is yet to be seen. And that's why I'm thrilled to be here tonight with these experts to talk about their work in this field, and in particular in the context of the COVID-19 pandemic. We know that pandemics exacerbate existing inequalities for women and girls and vulnerable populations, and this pandemic is absolutely no exception. So I am absolutely thrilled tonight to introduce our panelists. The first person is Karina Barreto. She's our coordinator at Casa Angela in Brazil. Karina is a midwife and has worked in maternal and child health and reproductive health for many years. She's also a lecturer in undergraduate midwifery at São Paulo University. We have Emma France, who is the Global Development and Strategic Director at Mothers to Mothers. Emma established the European Office of Mothers to Mothers back in 2011, and in her current role, she leads the global development and strategy efforts. She's also responsible for the day-to-day work of Mother to Mother's European and North American operations. Next up, we have Corinne Namblach, and many of us from the Giving Women community know Corinne very well. Corinne recently joined the International Advisory Board of Help Mum, based in Nigeria. In addition to sitting on many other boards and scientific committees, Corinne's reputation precedes her. She worked for the UN. She previously worked in private equity, and she's quite known across the Giving Women community. And then we have Constance Thaysen, who's the head of international programs. She joined Médecins du Monde, which we'll probably refer to tonight as MDM. She joined MDM Swiss, so in Switzerland, back in 2018 to lead their international and domestic programs. After spending about 8 years managing humanitarian programs for the French state and for MSF, so Médecins Sans Frontières, she's worked across many different crisis and developing country contexts, including Bangladesh, Afghanistan, Iraq, Nigeria, and many others. So again, I would like to thank our panelists and our participants for being here today. We appreciate you taking the time. And again, on behalf of Giving Women, just so thrilled to be moderating this panel. I absolutely love this Giving Women community. It has brought so much to my life in the couple of years that I've been living here in Geneva. And we're thrilled to be able to present and curate this session for you. We hope it'll be a learning experience for everyone. So with that, I'd like to hand over to Emma to please introduce this first short film clip before we jump into the panel discussion and then following a Q&A. Thanks so much. Over to you, Emma.
Good evening, Giving Women. You're about to hear the story of Femia Mangani, an M2M mentor mother from Malawi. Like all expectant mothers, her priority and dream was for her baby to be born healthy and start life with the best possible odds. But unlike most expectant mothers, she didn't have the luxury of easily accessible healthcare, of easily accessible information, and on top of that, she was living with HIV. But that changed when she met Mothers to Mothers. Femia's story is so similar to many of the women we work with, one of hope, of resilience, of overcoming adversity and stigma, and of the overwhelming desire to give back and help her peers. Here is Femia's story.
Leo ni wedi neno mbikizira kumbolanga nero kuti ndikhali ndi mwana wopanda kachilombo chomwe ndimakhumba ine chinali chimenecho. Mene ndinalombikizira nayi ndi mimba ya miyezi 3 nazayenderedwa ndalangizi a amayi anazayendera pakulupo mpano ndipo ndinazacheza nawo anandifunsa zokhudza kuyamba sikelo ndinawuza kuti sinayambe sikelo ndipo anandiunikira ubwino kuyamba sikelo anandiwuzanso ubwino kuyezesa magazi nditapita kuyezesa magazi kuja ndinapezeka kuti ndili ndi kachilombo kuyambisa matenda a AIDS. Ndabwera kuya kwauza anthu zosadya zanga ndinazauza amayi anga ndi amunanga. Ndachilandirabe komabe ndinachilandira movutika koma amene nditangokumana nawo alangizi a amayiwo ananditanthauzira zina ndinayamba kukhala womasuka. Blessings ndinamwezesapo atangotha 6 weeks magazi akuchitende ndipo anapezeka negative. Ukuti apachaka paja ndinazambirisaso kamwezesa magazi apacha anapezekanso negative. Panopa kumangophunzira kuimba. Muziki makonda yake ngomva nyimbo amakonda kubvina kwambiri. Ineyo chomwe chinandipangisa kuti ndilembere nawo ntchito ya ulangizi wa amayi. Chifukwa chomwe ndinadusa mwene ndaona kuti mmene ndimadusamo nayi ndili nsanakwane zaka 20. Ndinaona kuti achinyamata ambiri amata kukhala ndi moyo osochera kamba kozibisa kamba kosikolo usowasoyena uphungu kulangizidwa enanso kunyozera kumene. Ntchito yanga ndimayendera ndimathandizana ndi azimayi achisozera amene yangobereka komanso ndimapeza anthu amene ali ndi kachilombo ka HIV, azimayi akuyamwitsa amene ali ndi kachilombo ka HIV komanso kuyambikizira ana ang'ono amene ali ndi kachilombo ka HIV, ananso amene abadwa kwa azimayi amene ali ndi kachilombo ka HIV. Timathandizana zina zokhudza umoyo wawo. China chilichonse changa chinasintha. Olo moyo wanga thanzi langabe linasintha. Olo maganizidwe anga anasintha. Chifukwa poyambirira ndimakuganiza zofowokabe basi. Olo ndingapasidwa uphungu nake ndimaganiza zofowoka. Koma china chilichonse changa chinasintha. Kuti panopa ndingati ndikumazilamulirabe ndekhamene ndikasowa chinthu ndimata kumazipezera ndekhamene. Gulu langa ndimaona kuti ikuza kukhala luwala chifukwa ndikuza kuzazipezera ndekhamene nyumba kuzamanga nyumba komanso mwananga ndikuzabe kuti azakhabe pamoyo ondidalira ine nzatha kumuthandizira kuti azakhale ndi moyo uzasoyekera kenakake kumbali yanga ndizayisisabe.
Communities, right? And the third one is the leverage from the formidable, technology quantum leap that Africa has been taking, and in particular Nigeria. And here, let me just give for that last part, the fact that the internet users account 135 million people who have access to, internet. The penetration rate is around 50% plus. It's going to be 85% by 2023. And there are 40 million smartphones today, and it's expected to reach 140 million in 2025. So it's exponential, and I think that also illustrates the challenge, for Help Mom, where it is confronted with work in very remote rural areas or underserved urban areas in an immensely dense population, but with obviously the opportunity to do something and go digital. So we'll go back to that. Now, when it comes to clean birth kits, as you were saying, Kelsey, It's amazing to think that, you know, this bright green, you know, bag with a beautiful Help Mom logo contains only 11 items, but 11 very, very critical items. The first one is a pad. It's a clean, you know, pad that women can use either on a bed if they have a bed, or sometimes on the soil. A number of women still give birth literally in their homes on the, you know, on the soil. So you can imagine how important, you know, trying to ensure a bit of privacy, a bit of cleanliness, you know, around her is critical. The second item, most important item, is a sterile razor blade. Up until recently, TBAs, the traditional birth attendants, were using old, used, rusted razor blades without necessarily cleaning them. And if you look at the stats, 70% of the death that happen for women in Nigeria during delivery are related to septic shock. I mean, you know, infection. Obviously, postpartum, you know, hemorrhage is one of them, but it's mostly infectious, you know, infection right from the beginning. And then there are clamps for the umbilical cord. There are gloves for the midwife. There are pads for the mothers, you know, after birth. There are lotions, septic lotions, all kinds of things to help make this delivery as hygienic and as, you know, well protected, safe, shall we say, as possible. You know, this is what the birth kits are all about. Now, the birth kits can be either distributed for free. A number of donors, for example, have approached Help Mom and said, we are ready to, you know, pay for these birth kits because we want to ensure a free distribution. But the birth kits have been organized also so that the women can actually either pay for them and or save money. And so this is, again, you know, going back to Emma, who's discussing, you know, the mother-to-mother model. The model here is actually also a financial empowering model. What happens is that Help Mom has actually engaged with the TBAs, the traditional birth attendants, the midwives, and say, if you help us, you know, sell and or distribute the birth kits, we will incentivize you, and it is $1 equivalent for a $5 cost, you know, to the women who are either saving or are ready to pay for it. Now, you'd think that this could be an important amount of money, but it doesn't, you know, it's not because you are in a remote rural area that you don't have the financial means, you know, to actually pay for it and or save for it. Actually, Dr. Adarani was sharing with me the fact that they have been testing, you know, how much money women could be spending, you know, for themselves, for hygienic products, for the children, for this, for that. And it's a much higher amount. So $5, I think, has been designed, you know, with that capacity, you know, payment capacity of women. And really interestingly enough, so the savings scheme is actually sort of managed within the community. You see what I mean? And then word of mouth actually spreads and says, well, you know, if you go to the traditional birth attendant, this is where you will be able to find that kit. And obviously, and we'll come back to the educational part, but the distribution of the birth kits has been a leverage, a lever for Help Mom to engage even further with the TBAs, because obviously if there are more hygienic deliveries and safer deliveries, their track record, obviously as a midwife, goes up, and there are less mortality, and their standing in the community augments, right? And so the whole idea was to say, well, we are going to continue to educate you. We are going to provide you with on-site training. You know, we will get, you know, volunteers, doctors, et cetera, et cetera. And I think that is, I would say, sort of pre-COVID. And obviously with COVID, that part of education plus the vaccination tracking system, which I will describe maybe a bit later, has actually allowed Help Mom to go digital in a huge way. And I'll happy to come back to that after. Second question.
Fantastic. Thanks so much, Corinne. We never have enough time on these panels because
I
I have
know.
these follow-up questions for all of you. But I think we've sort of started off with, a general overview of what are some of the challenges around maternal health. We've zoomed in a little bit on different types of interventions, a few different countries. Now let's pivot a little bit and let's move towards COVID. I mean, ultimately, maternal health is a priority. It's always been a priority. Constance has said we've made huge gains, but not enough. We're not going to meet SDG 3.1 by 2030. We know this. And how is COVID impacting this even further? So Emma, we'd love to turn to you to hear a little bit about From Mothers to Mothers around what are some of the new challenges that are coming up? We know the existing challenges, but how is COVID exacerbating inequity or lack of access to high quality services? And how are you and your organization adapting or pivoting? What kind of innovative approaches are you having to implement to get through this period? And for gosh knows how long it's going to last. So Emma, over to you.
Thank you, Kelsey. And how long this is going to last for is obviously the million-dollar question that we're trying to answer at the moment, and suspect it will be a several million-dollar question. So I think it's fair to say that, and we know this in our own lives, COVID is dragging resources and diverting resources away from everything that is regular, and certainly in our world in sub-Saharan Africa, resources are being diverted from regular service delivery to urgent response efforts, as they are everywhere, and they are making it harder for pregnant women and mothers to access services. And so for us, COVID-19 is just the tip of the iceberg, because we are already functioning in weakened, stretched health systems, and so they were already in many of our countries at breaking point, and this is just making it frankly harder. The African continent already has a shortage of 4.2 million community healthcare workers. By 2030, that number will go up to 6.1 million. And so we are already dealing with chronic undercapacity. And whilst it's extraordinary that we have employed 11,000 mental mothers as community healthcare workers in our time, that doesn't touch the sides in terms of the gaps that we already see. UNICEF have predicted that 6,000 or more children under 5 could die every day from preventable causes during this period. And UNAIDS and WHO have predicted an excess of 500,000 deaths due to disruptions to HIV services. And to give you context, that would turn the clock back to levels not seen since 2010. And so in our work, it's already, I think it's Confucius, our work is already like pushing an enormous rock up a hill and hoping that we can continue to prevent mother-to-child transmission, which, as we know, is entirely preventable. Maternal death is preventable. We are always trying to do that regardless of what's going on, whether it's cyclones, whether it's hurricanes, whether it's other pandemics like Ebola. But what we're seeing with COVID is this potential to take us so far back. Again, UNICEF sources, the potential for an additional almost 60,000 maternal deaths in just the next 6 months, a potential for a general increase of almost 40% of increase in maternal deaths each month. And this is the untold story of COVID in a world like ours, where business as usual is preventing women from dying while they're having babies, preventing mothers from passing HIV to their babies. COVID isn't just a distraction, but it's a monumental kind of roadblock in the way to providing those services. And so mothers to mothers, pregnant mothers, and in fact, all pregnant mothers and new mothers are even more at risk. They have the challenge of dealing with both an epidemic in HIV and a pandemic in COVID-19. And so all pregnant women require and critically deserve antenatal care visits from a skilled healthcare worker to achieve the best outcomes for themselves and their newborns. And that is harder right now, but mothers to mothers, mental mothers have been designated as essential workers, thank goodness, which, you know, at the beginning, Kelsey, you asked what makes mothers to mothers different, and mothers to mothers, mental mothers have really been incorporated into the fabric of the health systems that we're strengthening. And so them being classified as essential workers in countries in lockdown is critical while we continue to reach the most vulnerable and remote clients, and continuing to ensure that maternal health is a priority. Babies are going to be born regardless of what else is going on, and we need to ensure that that happens safely. And so to do that, we have created a two-pronged response. Immediate adaptation of our model, which I should add was long planned in terms of the delivery of universal healthcare, but hugely brought up the agenda in terms of how quickly we wanted to deliver it because of COVID. How are we adapting our services? We're dramatically altering, and as you would imagine, altering or reducing face-to-face services. The women that I described earlier in our session, the women who are going house to house in the community, are now tending to work safely from facilities and making e-contact, telephone contact with their clients. We are pivoting to e-services so that we can immediately reimagine how we reach and how we serve clients using tools that they already use, such as WhatsApp and phone calls, to engage clients where possible, so that we have no loss to follow up during this time, so that women are still prompted to access care, so that the lifeline that mental mothers always have been continues to be present in a world that is already, you know, enormously changing and, you know, rife with gender-based violence and all sorts of things that have been more pronounced during this. We've updated our curriculum to tackle COVID-19 so that the services that women are receiving are not just their normal business as usual services, but business as usual services within the pandemic. We're also protecting mental mothers. We've needed to, as the rest of the world has, urgently procure appropriate PPE for mental mothers, insisted that those mental mothers have recent viral load testing or known CD4 counts, so that each of our frontline staff living with HIV who are already immunocompromised are safe to provide the services that they need to provide. We're critically also providing increased mental health support to all colleagues and ensuring that our staff have access to testing services. And so our organisation has had to respond, as the rest of the world has, very rapidly to what is a very changing situation in 10 countries that we work in, all of whom are at a different pace in their own epidemic.
Thanks, Emma. Yeah, it's incredible to see how quickly organizations can be, how nimble, you know, all of a sudden pivoting to e-services and different other types of models. You know, it's incredible how resilient these frontline health workers are to be able to adapt so quickly, obviously with the support of organizations who are, you know, supporting them. Karina, we'd love to hear from you to hear a little bit how Casa Angela is adapting, because while we talk about, you know, e-contacts and e-services and innovative technology, women still have to have babies, and therefore anecdotal evidence is already showing that home births are going up in low and middle income countries. What are some of the trends that you're seeing across the birthing center at Casa Angela?
Hello, are you listening? It's okay, yeah?
Yes, we can hear you very clearly. Yeah.
So just talk about COVID in Brazil is another challenge. I will just go back to Casa Angela, but just because it's really a messy right now, and it's really a challenge because we have this cultural thing that we have. Brazilians are very close, with physical close. We like to hug, we like to kiss each other. So COVID is really difficult for us because we really have to do social distance. And so it's one cultural thing that we have. And we have a big problem with our leaders because we don't have strong leaders. And so we have a fight by power and by power and money that is around, like all the governments, like federal is not agree with the states and with the cities, and that make our policies much worse, and the public health system really hard to know what to do, and even the population. And think about that, COVID really affects, of course, the whole population, but the women much more, because 4% of our population don't have a formal work, and so they could not work. And a lot of these women, much of them are pregnant. And one thing that we are dealing, like in Casa Angela, is that our most vulnerable community, the pregnant that didn't have work anymore, they could not work to buy food. So it's not just about maternal care, healthcare. It's about they don't have how to buy food, and how we care about the nutrition of these women. Of course, we did a lot of adaptation in our organization to still keep it going, because we could choose not care of these women and close doors, but we choose to try to do our best. And of course, we are a low risk birthplace, so we don't have symptomatic women's, just asymptomatics. But how the hospitals are so crowded with COVID, women are really scared to go to these hospitals and get some things COVID there. And even all the obstetrical violence are much more now, because they are not allowed partners to go in with the women's, and a lot of stuff, like women are really afraid to go to the hospitals. So we are having much more demand, much more women are looking to have babies with us, and in birth centers like what we have. And we used to have a lot of groups, like orientation groups, and yeah, we used to like this kind of organizations in groups. And now all the in groups we are just doing online. But of course, even in the São Paulo is the most city in Brazil, but we are in a south of São Paulo city, and in this area is very unequal. So we have a big community that really don't have access to internet. I know it's like Brazil and in São Paulo city, but even in this city, we have women that don't have access to internet. And so we have a whole flow to help these women, like with calls, and we have midwives and could do domestic visit if needed. And of course, all our staff have the PPEs to deal with COVID. And we don't have tests for everyone. So we are not have money to have tests for everyone, for our staff. So it's really a kind of a risk that our staff is getting. But yeah, it's how we could do. Like the time of the appointment, we have less time, but we still have appointments. We still have this online, that is an innovation for us. Was the first time that you build things like that. And the women are really enjoying this, because it's possible to get the information without risk themselves. And for the births, we change a little bit, but like the staff have to use all the PPE, but the women doesn't have to use, because how we just use work with low risk women. We are not, it's really hard to like being in birth with mask. So we let there by how she wanted. But she just have, normally we have 2 partners with her, and now she just have 1. Yeah, but yeah, the birth is almost the same. We have some related, like some women told us that she miss like hugging, because normally we, after births, we hug and we are really happy about it. And now we miss that. But we really trying to keep doing like this nice work with all the PPIs and all this changing. But like in Casa Angela, we really try to do it. But it's, of course, all the projects, we are really struggled, because what pay like support us is 7% was the public health care system, but the other 30% we have to find donations, we have to look for money, and with the PPI they are very expensive, and we are really struggled to deal with that. Another little thing that we did, but I think it's really important to say, we get a donation about food supplies, and we have 40% of our population are very vulnerable in this area, and we look to give these food supplies to these families to help to deal with that, because really it's a challenge, not just with health, but this essential like food, like how these women get nutrition during the whole pregnancy. Yeah, I think it's enough.
Yeah, no, thanks so much, Karina. I mean, as you said, there's so many factors there, including the costs. You know, already for some of these interventions and programs to be providing these high quality services at an affordable or no cost opportunity, and now the cost of the PPEs and adjusting the protocols, I mean, it's enormous and it's a burden. And we will be sharing, Kathleen will be sharing in the chat box, you know, ways that our giving member community can get more information and can donate, because obviously we love to talk about these things, but we also like action at Giving Women. We want to know, how can people get involved? How can they educate? How can they donate? How can they share amongst their networks? How can they help you? So absolutely, Kathleen and everyone will be sharing some information in the chat box, and you can always visit our Giving Women website or contact us for further information. I'm looking at the clock and time is ticking away. We have so many other questions for our fabulous panelists, but it's already 10 after 8. I just want to ask one more question to our panelists, and then we're going to open it up to our Giving Women members and to some of our attendees. And it's really based on a conversation that we'd had a couple weeks ago with some of our panelists, and with Corinne in particular. Corinne, in our past discussions, you know, you were mentioning that there was this interesting commentary and reflection in the media coverage in France and other locations about women's roles in society in light of COVID, and, you know, the double workload. And we know that the double burden already of women's role in the house and in the workplace and having children, and now with COVID, people are talking about this double workload. I mean, it's always been there, but thank you to the French media for all of a sudden reflecting on this. But maybe you can tell us a little bit more about how this is reflected also in places like Nigeria. How is COVID actually practically affecting these women and some of the beneficiaries of the Help Mom program?
Look, as I said, you know, the reason I discussed these images and things that I had picked up in the international media as well as the French media was to build a red thread, you know, throughout our community, because we are here and, you know, we are engaged, you know, elsewhere around the planet. And I just wanted to show the red thread. I probably, because of the sake of time, I won't go there. But I'm just going to just give you a couple of images that really struck me whilst I was, you know, confined in Paris. The image of a luxurious hotel in Ukraine, where hundreds of babies are in bassinets, born to surrogate mothers and waiting for their parents to come and pick them up because nobody can enter, you know, Ukraine. Think of it, okay? It's just an aspect that nobody's discussed, but that is a fact of life, okay? In Paris, yes, women being celebrated, you know, for having been the frontline warriors, but all of a sudden people realizing that they're not paid or not paid enough, the lowest salaries, you know, so celebrated, yes, but not paid. Celebrated, but not interviewed. Only 28% of women were interviewed by French TV media during COVID. You know, these are very striking things. Women secretly at night still going out during confinement and posting, you know, these posters, sort of hand-printed posters on the walls in Paris saying, be loud, be proud, you know, speak up. This is about domestic violence. Also, the fact that the journalists are all of a sudden discovering that the call centers saw a spike, you know, in calls in the first week and then silence, because obviously when victims and abusers are in the same space, how do you call? I mean, how do you get out? How do you speak out? You know, it was a lot of hypocrisy, and that's why I was sort of reacting to that and saying, you know, the unsung heroes need to be heard, and we probably need to focus, and obviously that, you know, not to paraphrase, but women's lives matter, you know, and we really have to sing that and talk to that, you know, as much as we possibly can. What I've seen in Nigeria in my conversations, you know, with Dr. Adereni is the fact that yes, you know, when there is a pandemic, it amplifies and it heightens all existing inequalities in a way. And these impact is exacerbated, you know, with COVID-19. And it is an economic impact because women tend to earn less, they save less, they hardly have enough, you know, food to buy for their children, they hold unsecure jobs, they live close to poverty. The health impact, you know, we've talked about with the reallocation of funds, you know, for COVID and not necessarily for maternal health. Unpaid care work, you know, we've talked about that, gender-based violence, name it. So the same issues, what I was describing, you know, here in France and in Europe and in the US is happening also, but much more exacerbated, much more amplified, obviously, in a country where, you know, if you can't go to the market and sell your produce, you have no money. You can't feed your family, you know. So it's just as basic as that. And as Karina was saying, but what is really interesting is how you know, Help Mom has been pivoting, you know, very, as you said, very nimble, very agile, and obviously, you know, the physical aspect of going on site, delivering, sending the volunteers was no longer possible. So how do you leave people totally stranded when, you know, as you say, COVID or not, babies are born and women need, you know, help. And again, I think what is really interesting is all the focus pre-COVID was accelerated, as Emma was saying, you know, all the things that had been talked about, brainstorm, all of a sudden we knew that we just had to push for it. So obviously the first focus of Dr. Adereni was ensuring that his teams were safe. And it was just as simple as, you know, obviously protective measures, sewing masks. And this is, you know, one of the things we did. But it was also sort of an aha moment saying, well, how do we ensure that we pass on these messages to the community? Aha, the VTS, the vaccination tracking system, which is the digital tool that Help Mom had developed previous COVID, you know, in order to help mothers with babies, you know, to provide their name, their information, so that a Help Mom could provide in their own indigenous language. I must insist on that because that is so brilliant. Messages, you know, to bring their children, explain what the immunization is, where to bring the children because it's free in Nigeria. So this was pre-COVID. And obviously using the same tool just to send these messages about, you know, how to hygienic, you know, self-preservation messages, resilience messages through that sort of telephone link, not smartphone, simple telcos, but an opportunity to reach out, you know, thousands of women. And actually within 1 year, Dr. Adereni was telling me that they had, you know, enlisted 25,000 women. And obviously one woman, you know, within a community will talk to other women. So all the messages about health, resilience have been just passed on. The beauty is that with COVID and with this reallocation and redistribution of or expansion or of issues, the VTS, the tracker system, is actually allowing to build bridges in communication, not only with women, but also with traditional birth attendants. And I won't say too much because there's a major announcement that Help Mom will be making on July 4th. It's a major award that they have won, which is going to expand completely this digital platform that they have been using and that they are going to be using for more e-learning, more bridging, you know, with the community of the midwives, but also, you know, with, you know, drawing in, you know, other women from the community. So I can't say too much because that's the privilege, and I invite you all to, you know, go to the website on July 4th and get all the news, but it's really, really exciting. And it just consolidates, you know, it's that 360-degree sort of approach to the problem. and trying to yes, use it as a lever, as a tool. And what I think is really beautiful is that the Nigerian health authorities were already taking note of the fact that with the VTS tracker system, the Help Mom had 100% hit rate. All the women who received in their own indigenous language a message to take their children for immunization did it. 100% of those who received it. Obviously, some women did not because the information was incorrect or whatever, but 100% of those who received it went, which just is an incredible hit ratio when the immunization rate in Nigeria is one of the lowest in the world. It's 13% only. And obviously, you know, death preventable under 5 target. So again, you know, the brainstorming that we've done has been around an immediate response, the masks, how do we deploy people, how do we make sure that, you know, we can distribute as much as we possibly can, how do we continue to involve the TBAs and empower financially women, you know, obviously through this, and how do we continue to educate, how do we use this digital tool for even greater outreach and dissemination of information. So
thank you so much, Corinne. And we look forward to hearing about this big announcement. You've left us with a cliffhanger here. So obviously we're all eager to hear about it in our next Giving Women Lunch and or on July 4th. But
absolutely, it's very exciting.
And Dr. Adirani, congratulations. I know he's on the call as well, so that's fantastic. I promise we're going to hand over to open up for questions. So you can already start posting your questions in the chat, or you can put up your hand and let us know that you have a question, and then we'll call on you. While everyone is thinking of their questions and writing them in the chat, I have a final question for Constance, actually, because we know that getting funding and keeping maternal health as part of the conversation is challenging. So ultimately, how are we going to make sure that maternal health is not overshadowed by the current global pandemic? So in terms of advocacy, awareness raising, keeping it at the top of the global health agenda, how can we maintain the discussion on all aspects of maternal health, policy, planning, prevention, implementation, all of it? We'd love to hear how Constance and how MDM are planning to keep it up there on the agenda.
It's a trick question, Kelsey. It's a tough one. I think by being vigilant as people, as women, to make sure that this moment is not used by groups or people with a different agenda to go back on gains. And being vigilant ourselves that we actually do not, as health organizations, set aside our current operations and our current beneficiaries for other at-risk groups because of the COVID pandemic. So to make sure that we maintain our current programs, and all the organizations that just spoke are doing exactly that and have made it a point. And it is an effort. And to make sure that we continue to engage and prioritize this area of work. Needs are still there. Needs have actually increased. It's all the scenario of think tanks and international organizations. They've increased today. They will increase in the future even further. So we need to continue engaging with national authorities. And in that sense, I think COVID can be, in a way, an opportunity, because as a health organization like MDM, we've never, or it's really, we work in so close a partnership with national authorities right now on the COVID response, that it's the opportunity to bring our other concerns to them. Yeah. There's also disruptions of the current general framework, with WHO being now questioned and its leadership role. So yeah, it's really, I think, vigilance from all of us, going back to basics apparently, because it's needed in our messaging, reminding everyone that the needs are there, that the needs were always there, and that the needs are continuing to be there. We can use numbers and projections of how they will increase, how more unsafe abortions we will have in the future, how much more unplanned pregnancies we will have because people are not accessing services right now. And yeah, continuing our efforts.
Yeah. Well, and actually that's a good segue. Let's open up the floor. I mean, Constance, I love that you were a positive spin there. You said, let's use it as an opportunity. Every challenge can be turned into an opportunity. So let's stick with that mantra. let's open it up for questions from our Giving Women members and attendees in the audience. So feel free to either put your hand up virtually if you know how to do that, or to message us in the chat there.
Yeah, and then when you put your hand up, you can also just unmute yourself and ask the question. So.
And of course, I have hundreds of more questions for the panelists if no one else has one.
I'll just continue and allow people to, to come up with questions. I just wanted to flag something.
There are already some questions in the chat, I think.
Ah, good.
Yes. So Victoria Paget, thank you so much for your question. The question is to Emma France, I believe. You've called the women accessing the trained mentor mothers clients. Do pregnant women pay for the services they receive? And if so, how do you ensure the services remain affordable? And if not, how do you fund the mentor's salaries sustainably?
Brilliant questions. So no, people don't pay us for our services. Many donors have, in fact, many donors have suggested all sorts of things to us over our years, that we shouldn't pay mentor mothers at all, that people should pay for our services, and many of those things are deeply contradictory. But fundamentally, sometimes people accessing it depends country to country. In some countries, some people pay a small amount to access maternal health services as dictated by that country. People never pay to access mothers to mothers services, and that at the moment is also key. Clients, I think it's very much a sense of providing services, giving women voice, giving women equity, not beneficiaries, not patients. Yes, they're patients within the facilities that they're in, but in terms of their relationship with a mentor mother, they are a client and they are procuring, not in a financial sense, but in an emotional sense, in a capacitated, empowered sense, the services they need to move through pregnancy and beyond. You know, we see many of these women for a 24-month period at least, all the way through pregnancy, through labour, breastfeeding, and up until children are 2. And so it's a very, very long relationship. Sustainability, I think, is always a stonkingly good question. And I think in terms of 2 kinds of sustainability, capital S sustainability that donors like best. We need you to exist without us. And so that is the hardest to achieve. And how Mothers to Mothers does that is by working at the invitation of governments and systematically, as quickly and smoothly as possible, getting governments to take on our services and take on the procurement of those services, but buy into the idea that we cannot deliver high quality services to clients without them having access to high quality peer services. So for example, in Kenya, we embedded ourselves and became the Kenyan Mentor Mother Programme. We were never Mothers to Mothers. We existed as part of the Kenyan government. In Mozambique, we're providing technical assistance to the government. South Africa, an extraordinary success story. Back when I started, we probably were running 500 clinics in South Africa. It was our largest country program. And now in all but one area, Mothers to Mothers in our country of birth is delivered within the South African health system. And so that is critical capital S sustainability. We don't want community healthcare workers and frontline healthcare workers, which are a critical part of delivering health systems, to only be funded by by charities, by international NGOs. We want them to be part of the lived experience of women. But until that point, we will continue to generate money so that those services exist. The small s sustainability for mothers to mothers is, to me, the most important. It is the fact that the 11,000 women we have trained as community healthcare workers will carry on being a mental mother at heart for the rest of their lives. They will not go to church without dispensing condom advice to adolescent boys who don't require it. They will not walk down the street and do their shopping without being an ear, sometimes now that we're 20 years old, almost to people having mothers to mothers grandchildren. And so the fact that what we do and what is most precious stays in our communities of operation forever, whether those women go on to become nurses, farmers, nail bar owners, house owners, that knowledge is there forever, and that knowledge is cascading into those communities forever, reminding people that they need to give birth in health facilities, that HIV is preventable. And to me, that is true sustainability.
Absolutely. Emma, thanks so much for that answer. We can hear the passion in your voice. And thank you, Victoria Paget, again for the question. Our next question is from Katarina Meyer-Pfister, and it's for Help Mom. So Corinne, this is for you. Yeah. How does Help Mom make sure that the most disadvantaged women get access to the clean birth kits if they cannot afford them? Because you did talk about that two-pronged model of those who could and couldn't afford them.
That's right. That's right. As far as I know, obviously Help Mom will rely on the community midwife, the TBA, trying to understand, if it is indeed affordable or not affordable. I think the model so far has been to have a number of birth kits that have been paid for, by donors, private donors, as well as NGOs. Sometimes, Dr. Adarani says, oh, we have to produce 200 birth kits at the demand of a private donor because they really want to, get involved. And so these bags, clean birth kits bags are available. So again, rely on the community to understand, where it is most needed and who needs to get it free of charge.
Thanks so much for that, Corinne. And just to let everyone know, we're going to actually go a few minutes over our scheduled time. I know I said in advance of the call, we're going to keep to time because everyone is hungry and have children to put to bed and things like that. But we have a few more questions and we really want to give everyone the opportunity. If you need to sign off, please by all means sign off. But otherwise, we're going to keep going for about another 10 or 11 minutes. Thanks so much, Corinne. And thank you so much for the question from the audience. We actually have a couple organizations in the audience that are very dear friends to Giving Women, and we would love to call on them and ask them an actual question and to hear a little bit about their organization. So our first question is for Véronique. I think, Véronique, if you could unmute yourself. She's from an organization called Zero Mothers Die, and ultimately it's an organization that we are very familiar with at Giving Women. We'd love to hear a little bit more about their use of technology and e-health, and also what's been their engagement with Giving Women and what has been their interaction so far. How is getting involved with Giving Women helped them? So everyone else on the call really can better understand how Giving Women works with its project circles. So Véronique, over to you.
Thank you, Kelsey, and thank you to Giving Women for the kind invitation tonight for Zero Mothers Die. So as you see just in the title, we are very ambitious as every panelist tonight. We want to go to zero. There is no other choice. There is no occasion for any women to die from pregnancy or causes related to birth. So we developed since 2014 when it was launched at the UN General Assembly in New York under the auspices of the UNAIDS mobile application, which specificity is to be localized. So there are messages already embedded in the mobile app. This is every weekly, it's a weekly message, short message, with clear information on what's happening during that week, during the pregnancy. So you have messages for week 11, week 13, 14, 15, etc. until birth, and then messages all along the first year of the birth of the child with vaccination messages. They're simple messages. The fact is that this app is localized, so totally adapt to the local needs in the diverse places in the world where we're working, in particular in Brazil, for example, with Frio Cruz Foundation. And a scientific article has been recently published on the website. You can see it on the research of women living in slums and their particular need to get informed, because the first step, the very initial step, is that the woman has the correct information, right? And then when she is informed, then she can take better decisions at a better moment, right? So it's all a kind of chain to establish. But the first step is that the woman has the adequate information. And women living in rural areas, far away, they don't get visits of midwives so far. They sometimes don't go to antenatal care so far in those countries. We work in Nigeria with birth kits, with Trafina Foundation as well. They are all free of charge. In Congo DR. And the app is actually translated in 8 languages, French, Spanish, English, but also Swahili, Orome, Amharic, and Portuguese, Brazilian, in order to have it really in the local language of the women. The women can download the whole app once on the mobile when she's connected to Wi-Fi or 3G. And then after, it's in the mobile. She can look at it whenever. She doesn't need any connection. So it makes it very easy to use in rural areas. And now we have a partner with Allo Docteur Africa, which is a new TV channel in France for all African Francophone countries, and that displays public health information, which is validated, which is scientific in French for those countries. And Zero Mothers Die is now a web app in that platform and accessible, and it has been reached 100,000 times since its launch in February. Now with the COVID, we have developed a specific web app, which is called Epidemics Coronavirus. And every week and tonight, there is a web live TV we hold with experts in COVID, in order to discuss the fragilities around COVID. And we have the app in French directed to fragile populations and vulnerable populations, where all the information in COVID is displayed and viewed thousands of times every day for professionals, health professionals, and also for particular people. So we try to make all our efforts to disseminate the correct, verified information in times of a pandemic. It's terribly challenging, but it works. I can say it works quite well. The videos are viewed thousands of times also, and we will pursue in that way to use all those new technologies, power of communication, to inform. The better information is disseminated, then we have a chance to lower the ratio of deaths. We do much more things, but come to our Zero Mothers Die website, and with Giving Women, it was a fantastic, real fantastic. We had the project cycle for 1 year with fantastic experts in communication and marketing, and they helped us so much to review our communication tools, and we were happy that they appreciated it, but we had a few updates and improvements that makes all the difference, of course. And it has been really exciting period that I miss a lot, but well, we cannot be everywhere, and thanks Atalanti for your invitation. I'm so glad to see all your faces.
Thank you so much, Veronique. It's so great to hear about your organization. Please send the link in the chat box so that everyone can find it. And again, it's Zero Mothers Die. Please go to their website. She's showing the brochure. But yes, tech for good. I mean, there's so many uses and so many applications. In fact, I sometimes feel as though we should be having a panel on just tech for good and maternal health. I mean, so many ideas for future Giving Women panels. Adelanti, so much for us to plan. Two more questions before we wrap up. One is another organization we would love to highlight who's here with us and is again very close to Giving Women. We have Valeria and Linda from Green Lamp, which is an organization that also works with midwives in Ethiopia, and they have also been affected by COVID, just like everyone else. We'd love to hear from them. So over to you, Valeria. We will unmute your microphone.
Thank you. Yeah, we work with midwives, mostly in rural areas in Ethiopia, and COVID has, actually the numbers are quite low at the moment. Has an impact, but it's not as dramatic as we expected. But to prepare, the government has given some PPE, but we try to be proactive in the beginning and to give them more PPE for the midwives. So we actually started a crowdfunding campaign to raise money for that, and it was a very good, very interesting experience for us. But we were quite successful, and the PPE has been distributed and it is being used by the midwives. There has been, it's difficult there because everybody is very afraid of the virus. So the people are avoiding hospitals in any health facilities. And the midwives have reported that the antenatal, birth and postnatal visits come down quite a lot. And when they come to the health centers, it's because there is a problem. So in a way, it's more complicated because there is no follow to the problems that might make the birth difficult. So but they have been coping with the crisis well, because luckily the numbers have been quite low so far.
So far,
yes.
Cross our fingers. Valeria, it would be great. I mean, we don't have enough time, but if you could maybe share the link to your organization in the chat box there on the side, then everyone can also take a look and come back with some more questions as well.
If I may, Kelsey, but I don't know if I'm allowed, but I think that would also be a very interesting future Giving Women panel discussion, is how do you rebuild this broken relationship between the community and the healthcare worker or the healthcare structure.
Absolutely, and ensure that community-based interventions are truly community-based and actually informed by the community, and to really build that trust. I think that's a whole seminar on its own. I would love to, before we hand over to Adelanti to close, because it is getting late, I would have one more question for all the panelists, actually. And this is really, like, as we said, Giving Women is an action-oriented organization. So what are some of the practical things that Giving Women members that are listening today, or those who will listen to the recording later on, can really do to support maternal health awareness, education, interventions in their own countries and abroad? So I'm going to hand that over. It's open to any of the panelists that would like to respond to that.
Thank you. I think the most important thing is to follow all of our work. I'm sure we all have social media channels. Mothers to Mothers is at Mothers to Mothers. We're on Instagram, we're on Twitter at M2M Tweets. We're on Facebook as well. And I think follow our work, sign up to our newsletter, and be inspired by the fact that the work we do is and always has been on is preventable. You know, we prevent maternal death, we prevent transmission of mother to child transmission. It's just what we're doing at the moment is harder because of COVID. If you are so minded, donating is always wonderful. £30 can ensure that we reach even more clients by ensuring that a mental mother has a month's worth of airtime and phone data to reach women who are now locked off. And I think fundamentally making sure that women's voices are at the heart of decision making. We talked about the advocacy plays that we need to make, and actually if we always have women at the center of decision making around maternal health. And if you as an extraordinary Giving Women community continue to advocate that and push for that in the organizations you support and serve, we will have women making decisions about their sexual and reproductive health.
Absolutely. Thanks, Emma. Any additions from other panelists, please? I think Constance and Karine.
Sure. Constance, do you want to go?
I would say exactly the same as Emma, becoming advocates yourselves. So being aware is the first step. The numbers are high, the numbers are unacceptable. It's one of the major leading causes of death for women from 15 to 40 or 50. It's not acceptable for us to not do more and to suddenly forget these needs in a time of crisis. So speaking about it as much as possible, and individual advocates, it's you're adding on to our work, and you're adding on to the fight.
Absolutely. Everyone here is an activist. Karine, over to you.
Sure. I think as I quoted, something that I read on the walls in Paris, be proud, be loud. And I think it actually supports and seconds, what's been said is, to become an advocate, to become vocal about it. And I would even say to, in as much as we can, given our different roles, is to ensure that in designing, this post-COVID world and socio-economic plan, and, that we actually put women and girls at the center. This is half of the world's population. And too many times decisions are taken without, ensuring that women are involved. And I would like to highlight the information which was passed on by my friend Tina, who's online, and it's called The Invisible Woman. It's a book about exposing data bias in a world designed by men. And it is fabulously interesting because obviously if you process information in that is wrong or biased in the beginning, then the output is going to be wrong in the end. And I think we have to, I'm very big on stats and I'm big on numbers, because in a way you leave the emotion behind and you really absolutely face the facts, the hard facts, the numbers, as Constance was saying, come on, let's go, let's do it, and that's why I think, be proud, be loud is part of what I would like to recommend, we continue doing as a group of Giving Women.
Thank you so much, Karine. I love that. Be proud, be loud. I love it so much. Before I hand over to Adelante, Karina from Brazil, any final words from your side? Any words of encouragement to Giving Women members, how we can all better support your work and your organizations?
Yeah, I think I same the thing of all the girls, like it's really important to be proud, be loud, and we talk about, and don't forget, he always gives information to the women. And remember, what we do is really important. What we do, we really believe that is the way that we could change the world, because it's like birth, it's so important that really could change how the women see herself and the birth and how she will take care of the kid. And it's a really very good opportunity to give her this information, and maybe she figured out that she have this power to choose. And so for us, that's really impacting, and it's really transformation, like in all the family life and maybe the community and maybe in the world. So let's take good care of these women.
Absolutely. Okay, ladies, thank you so much. You are all inspiring, and I always feel my heart is always warm after these webinars. I want to thank you again, and I'd like to hand over to Adelante for some final closing remarks.
So, first of all, I'd like to thank Kelsey for doing an amazing job. She is like our resident moderator. You're amazing. I think this was a very tough subject because it's so broad. It touches everybody. And I think what I'm getting out of this is this was an opportunity, and this is why we do it. This is an opportunity to get people around the table who are working on the same issue, learning from each other and working together. My mantra is, I believe in the power of one, but the magic of many. And I think the more of us that work together, we're doing very, very similar things. The more of us that sit around the table and make those things happen together, the more impactful we're going to be. So that my sort of ending remark would be, let's continue this conversation. And all of you that have been so kind as to join us today, your role, your action is to pass these messages out to a much broader public and make people aware of what these issues are. There are a lot of people out there that don't really, really understand that these are really, really profound issues affecting women's life. We take it for granted that we will give birth and it will be fine. And for a lot of women out there isn't. So I think our role is take action, talk about it, and let's keep talking and let's keep working together. So I'd like to thank our amazing panelists. I'd like to thank you all. It has been, as always, inspiring. Kelsey, Kathleen, all this incredible team that came together. And let's keep talking. Let's keep these things going. So thank you so, so much, everybody. Have a wonderful evening.
Good night, everyone.
Good night.
Bye.
Bye. Good night, everybody. Thank you.
Thanks so
Good
much.
night, everybody. Thank you for joining us. And we'll be back at the end of the summer.
Yeah.
Have a good summer.
Yeah.
Bye.
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 Bye, Karina. Thank you.
Bye.